Welcome to myUpchar. Today we have Dr. Rommel Tickoo with us, who is the Associate Director of Internal Medicine at Max Healthcare. Today we will talk about bird flu with him. This is an infectious disease that's currently spreading in India. What is bird flu? How is it different from normal flu?
Well, bird flu is basically avian influenza. It's a virus called influenza virus type A. There are three types, type A, B, and C, and this particular is the A variety. And there are subgroups in this. There are two types of protein in influenza virus A, H and N. And the ones which we are seeing in Kerala and other states is the H5N8 strain. And this particular strain hasn't infected humans as yet. And basically, avian influenza is an infection, viral infection. It infects birds, usually the poultry, the wild geese, and crows and ducks.
Does bird flu spread to humans?
It doesn't easily spread to humans, but there have been cases in the past where it has spread to humans, and there's been more than 50% mortality. So if it does happen to humans, it can cause complications, and the complications are same lung related that you see in flu, which is pneumonia, respiratory failure. Though the transmission doesn't happen easily, but if it happens, then there can be a mortality. So one has to be extremely careful, especially people who are handling birds or infected live or dead birds.
Is it safe to eat poultry products like eggs, chicken, etc.? Can bird flu spread through eating these?
Well, if it's properly cooked at temperatures of 75 and above, then there is no risk at all. You should not eat raw eggs or raw meat, poultry. If you eat raw food, which is basically poultry or eggs, then there's a risk of transmission. Otherwise, not.
Okay, so boiled eggs, omelets, fried eggs, etc. that we eat at home, all of those are fine.
Yeah, see, eggs, if they are properly cooked, you shouldn't eat half-boiled eggs. If it's a full-boiled egg or an omelette, then it shouldn't be a problem. Again, with chicken, which is cooked at 75 degrees and above, shouldn't be a problem. It's well cooked. It should not be pink. It should be well cooked. Because the virus dies at these temperatures, so there shouldn't be any risk. So eat well cooked poultry products.
So with COVID, we saw that older people were more at risk. Is any particular age group or demographic more at risk due to bird flu?
Well, the risk will be the same if it does get transmitted to humans. The risk will be the same as in flu, like elderly, 65 and above, or children, or those with comorbidities like diabetes, hypertension, heart disease, cancer patients, immunosuppressed patients. They all have the risk of complications, which is basically pneumonia, respiratory failure. So the risk will be more or less the same.
What are the symptoms one should look out for? How long before the symptoms start to show up?
Symptoms will mimic the common flu, which will be like cough, cold, headache, body ache, and eventually pneumonia and respiratory failure if it happens. So one has to look for these symptoms, and the incubation period is usually 1 to 5 days, but can stretch to 7 days. So one has to look for signs of respiratory infection, and if one is in close contact with birds or handling birds, then you have to be extremely careful. You have to take proper precautions.
Is there any way to tell just from observation if it is swine flu or normal influenza?
It will be very difficult to figure out based on history or examination. So one has to go by history, where if you have been in contact with birds who have been infected or dead birds, or if you've been in contact with somebody who had a flu-like illness, but only the test will actually tell you which strain of virus it is. So clinically, it might not be very easy to differentiate what sort of flu it is.
Do we have any treatment available for bird flu?
The treatment is the same that we use in H1N1, which is basically antiviral drugs. Oseltamivir is the drug which we use, and even zanamivir, which is not available in India, can be used. So treatment, tests, symptoms, this is more or less the same as you see in flu.
Can one get reinfected with bird flu?
Well, the risk of transmission anyway is very, very low. There are not many, there has been actually no human transmission in India till now of avian influenza. So for it to reinfect you is like far-fetched. So this infection doesn't easily spread to humans. It happens more to people who are handling live or dead birds who are infected. So it is too far-fetched to think that there will be reinfection. So there should be no panic associated with it. But yes, there is a risk. So we should watch for it. We should be vigilant. And people who handle actually such birds should be extremely careful.
So follow-up question from what you just said. What precautions should you take to prevent bird flu? Is there a vaccine for it?
No, there is no vaccine for it. There is one vaccine which is US FDA approved, but it is not available at the moment. Precautions are same. It's basically for people who are handling such birds or infected birds, they have to be extremely careful. They have to keep washing their hands, wear PPEs, and because human transmission is not very common, so I can't really stress on that. But if it happens and if there is a case, then again the same precautions where you wear a mask and keep washing your hands so that it doesn't get transmitted to other people. But as I said earlier, human to human transmission is very rare. Even transmission from birds to humans is also very rare. And we don't have any vaccine for it at the moment.
That's great to hear. The last question, Dr. Tickoo. Why does bird flu spread every year in India? What can we do as a country to stop it from happening every year?
I mean, it actually comes from the migratory birds or infected poultry because of the transport of poultry. So, what you can do is you have to watch out for signs of illness in the birds, and if they happen to suddenly become sick, then one has to be careful. Tell the authorities about it. They need to be culled so that the infection doesn't spread. And people who are handling them have to be extremely careful because they have a high risk of transmission. But other than that, I don't think there is much you can do about it because it comes from the other birds, the migratory birds. So one has to watch out for signs and symptoms of disease in them. And then if you find out that they are infected, then you have to make sure that it doesn't get transmitted to humans, which, as I said earlier, is rare, but it can happen. So keep washing your hands, wear a mask. These are the precautions which one has to take. And it's not something which is very, very common. And anyway, as I said earlier, human transmission rarely happens. So there is no need to panic.
Thank you so much, Dr. Tickoo. Those are all the questions we had for you. Thank you so much.